we continue with Dr. Kevin Kavanagh. Dr. Kavanagh is a retired ENT from Somerset, Kentucky. He is also the founder of a national organization, becoming an international organization, called Health Watch USA. And he has been nice enough to sort of take us through this pandemic. We asked you, I think, if you could do it, a couple of weeks at the beginning?
2 weeks, and it's been 2 years.
Little did we know, Dr. Kavanagh. Good morning. How are you?
Oh, good morning. I'm really good, Jack. Thank you.
I'm so glad to hear it. Omicron, everywhere you turn, Omicron is either being devastating or it's lightening up and we're seeing the end. It's not as bad. It's worse. What in the heck is the truth about the Omicron variant and this new variant of the Omicron variant?
Well, I tell you, Jack, one of the things I think we need to point out is I think we were one of the first U.S. news media to talk about the Stealth Omicron on Monday morning. We broke that pretty early. Omicron is hard to explain to people because its main lethality is in its infectivity, not in its case fatality rate. And people get, they get all confused by all these statistics. What an individual wants to know is, if I go into Walmart or I go into a retail establishment, what are my chances of getting this virus and getting very sick? And there are two questions there, and that pertains to what is the infectivity of the virus and what's the case fatality rate. Because as infections go up and infectivity goes up, the number of cases go up, and so does your chances of catching the virus and having a bad outcome. And so that's what's important. And if you look at our hospitals and the data of Kentucky hospitals, we are going through right now a surge which is equal to or greater than the surge we had last winter. So this is a very serious surge. It's a highly contagious virus. About 2.7% of our population is immunocompromised. About half our population has a comorbidity or is at risk for a severe outcome. And all of these individuals need to take precautions. And the number one precaution that you can take is to make sure that your immunity is up to par, and that's by becoming vaccinated. And that's whether or not you've had a previous infection or whether or not you've had a previous vaccination. You need to have your immunity as high as possible. So you need to either get vaccinated for the first time or get a booster. And boosters are shown, at least in the first couple of months, within the first 6 months, they are shown to provide good protection against severe outcomes with Omicron. And at least one study or report has shown 60 to 70% protection against symptomatic infections. So that right now is our best tool against getting infected.
Can we talk about the Omicron BA? Is that BA.2?
Yes, and that's the newest variant. And believe me, these variants are going to keep on coming. There's no reason to think that after all of them, they're suddenly going to stop. But the BA.2 is called the Stealth variant. It's called that because it's hard to distinguish that variant on a lab test from other variants. Now, your rapid test will still pick it up and say you've got SARS-CoV-2, but it won't necessarily tell you if you've got Omicron or Stealth Omicron or Delta.
So when you were talking about Stealth, you were talking about BA.2.
That's correct. Stealth
is... good. I just wanted to make that clear. Yeah,
Stealth is BA.2. And what we know is this. It's highly competitive with the original Omicron. It has a lot more mutations. It is increasing exponentially in Denmark, in England, and also in Germany, and it has a large number of cases in Norway, and it's also in the United States. Now, people don't really know exactly why it's outcompeting Omicron. As you know, Omicron is highly infectious. It's felt that this may be a little bit more infectious than Omicron, but one of the things that people are worried about, and especially some of the infectious disease experts out of Denmark, is that this may actually be escaping immunity. In other words, it's coming around and giving you a second case of coronavirus and COVID. And if your immunity has dropped, or if it's low, or you hadn't had an infection for 2 years, you may be in for a severe case. And so that's what's concerning. Now, on the upside, it appears to be no more virulent than Omicron. In other words, it's not causing more severe cases, but it's still something that is very concerning. And Jack, from my calculations, every way I calculate it, everybody in the United States now, I feel should be either immune from the vaccine or immune from a previous infection, or at least the vast majority of people, well over 90%. I mean, we are still in this mess. Herd immunity is not something that's going to take place. And whether you've had a previous infection or you've had a vaccination, you need to get your immunity boosted because, as you know, right now our therapeutics are in very short supply, and we want to try to put off any infection, especially if you're at high risk, until those are available and our healthcare system isn't as stressed as it is.
Dr. K, give us a report card here on how we are doing in Kentucky at this point.
Well, we're doing terribly. Right now, our cases are much greater than what we've seen during the last Christmas surge, and our hospitalizations and people on the ventilators are comparable to the surge over last winter. And so we're not doing well. Nationally, we're 4th in the number of cases per population, and we're 6th in the number of people hospitalized per population. And I'm telling you, the monoclonal antibodies and other therapeutics are in extremely short supply. And one of the things that really disturbs me is there is a narrative that's going around that, well, they're in short supply because the FDA is trying to kill off Republicans. No, that's not the case. 2 of the monoclonal antibodies are pooled because they don't work with Omicron. Remember, these are just a single antibody. That's why it says monoclonal. The cocktails are just 2. They're not a plethora of antibodies and all different types that you get when you get an infection or you get the vaccine. Plus, these things have to be made in a bag quantity. I mean, they come in bags. It's not just 1 or 2 drops of a vaccine. And so it's very difficult to manufacture them, very short supply. They're pretty much variant specific, and they're not a good strategy for first line of defense. So those that have been telling people to rely on monoclonal antibodies during a surge, that's not good advice. And I also need to point out that the narrative that this virus isn't dangerous, but yet it's a bioweapon doesn't make sense, or this virus isn't dangerous and the Democrats are trying to use it to kill off Republicans, that doesn't make sense. If that's the case, you need to respect the virus. Those are competing messages. People, you need to realize this pandemic is not a hoax. We need to be wearing N95 masks. We need to recognize that spread can occur in schools and children can spread it to caregivers, which may be at risk for this infection. And that's why our hospitals are filling, and filled hospitals can't treat patients that have heart attacks or strokes in an expeditious manner and get a good outcome. So we are really placing our country at risk. We're dividing our nation, and we're doing this at the same time we're facing challenges in Europe and in Southeast Asia. And so we really need to start uniting our country and building a strong nation. And key to that is going to be to get this pandemic under control.
Let me tell you a personal story. A friend of mine this week, and it makes a difference when you know somebody, that's experienced this, got very ill, and she was vaccinated, but she went to the emergency room because she was really very ill, and it turned out it was a good thing she went because her oxygen was really low. They tested her. She was positive for COVID. She was in the emergency room. Now, even though she was receiving treatment through oxygen and IV fluids, she was in the emergency room waiting for a room for over 2 days.
Well, yes, and the same thing's happening if you have a heart attack. You're not going to be seen with that magical 1 or 2 hours to get a stent put in place. It's highly unlikely. Heart attack can present just like GI distress. you're not going to be able to get this type of evaluations. We are in a very dangerous situation here, and people in Kentucky are acting crazy. You can't look at other places like New York where they've had mask mandates. They've had essentially vaccine passports requiring vaccinations to go into areas, where they've really take social distancing as seriously as they can. And we're not doing any of that and then expect to have the same outcome. You can't do less and expect to do better. And that's where we're in with Kentucky. We have had a number of Kentuckians which have gotten severely sick, thousands of Kentuckians which have died and died needlessly, all because of bad advice. You know, if you want to rally against mandates, fine, but wear an N95 mask during that rally and get vaccinated.
Here are two texts, two different people with two completely different opinions. I want to share them both with you at once here before we go off the air. This is a person that obviously doesn't think it's as big a deal as you're saying it is. He or she says, ask your guest why the Nutter Field House hasn't been converted into a field hospital if it's so out of control. Implication there being it's not so out of control, I guess. The next text is from someone else that says, please thank Dr. K for telling it like it is. Amen.
Yeah. Well,
isn't it interesting, the difference of opinion in this regard?
Well, yes. And the first question is easy to answer. They don't have the staff or personnel. They're having a hard time just staffing the hospital because people and staff members are getting sick. Now, they've been vaccinated or they've had previous infections, but the healthcare personnel are still getting sick and can't go into work. They don't have the people to staff. Look at the problems they're having in our schools and that they're trying to get staff for that. So yes, they need to realize that even a mild infection, let's say that this is just the flu, but yet it's 20 times more infectious. That will close down our nation. It will cripple frontline services along with our healthcare delivery system. And we're faced with an enemy here that is much worse than the flu. So don't take my word for it. Just open up your eyes. See what's going on with your friends. See what's going on at your local hospitals. And we need to rally and we need to start wearing masks, socially distancing, and getting vaccinations. And yes, the vaccine, maybe it only works for 6 months, but that will at least get you to a time period when our antivirals are available and get our healthcare system so it's not overrun. So let's just take 1 month at a time, and for now, let's use the tools which are available for us to use.
As always, thank you very much, Dr. K, for being with us this morning, and hope you have a nice weekend. We'll talk to you on Monday.
Thank you, Jack.